Tonight, Governor Cuomo is warning the volume of coronavirus patients may soon be too much for New York's hospitals. CBS 2's Lisa Rozner has that and the race to build more capacity.
Deploy the Army Corps of Engineers to come work with states to build temporary medical facilities.
Governor Cuomo making a plea to the president for help. He says New York State has around 3,000 intensive care unit beds, but they're already 80% occupied.
You overwhelm the hospitals. You have people on gurneys in hallways.
He says thousands of ventilators and ICU beds could be needed in the coming weeks. Dr. David Battinelli, medical director at Northwell Health, says respirators and masks are being used judiciously and plans are in place.
We've already canceled most of the elective cases within our hospitals. That'll give us opportunity for bed capacity. Worst case scenario, we might be doubling up in rooms that are currently single, but we are actually outfitted to have those be doubles.
NYU Langone Medical Center's Tisch Hospital already transformed a pediatric emergency room into a respiratory unit for adults. The Mount Sinai Health System is asking doctors not to take personal trips in case there's a surge in patients. And the head of New York City's Health and Hospitals says each of the 11 acute care hospitals have a plan to take on 100 extra patients each. Some cases would transform a cafeteria, an auditorium, or utilize parking lots, putting up tents made for creating clinical areas. Under Mayor Bloomberg's administration, around a dozen New York City hospitals closed due to financial pressures. A 2005 commission formed by then Governor Pataki recommended a 10% reduction in hospitals. Dr. Bruce Lee is a professor at the CUNY Graduate School of Public Health.
Not just in New York, but there's been a lot of consolidation of healthcare. So you've had mergers and acquisitions and different facilities being shut down. This is an unintended consequence of that occurring.
Governor Cuomo says for now, the state is organizing the National Guard and building units to change facilities like dorms and former nursing homes into intensive care units. On the Upper East Side, Lisa Rozner, CBS 2 News.
And Cuomo says in New York City, 5,000 extra beds have now been identified. The White House did not get back to us for comment on whether the president will actually offer federal resources to build extra space.